up to sort of applying for the SBCR and who I am. I'm a GP by background. Sorry, Jess, could we go on to the next one? Thank you. And I took quite a traditional route in clinical academia. So in my undergrad, I took a year out and did a master's in research in 2011. After graduating from medicine, I applied for the Academic Foundation Programme and was successful up in Manchester, and did this between 2013 and 2015. And during my master's in research and my AFP, I did research with the severe asthma group up in Manchester. So I realised I wanted to continue in academia, and also really realised clinically that I wanted to be a GP. So I applied for the GP Academic Clinical Fellowship and was successful. For those that don't know, this is normally a 4-year programme with a year to do research. I actually made this a 7-year programme by having 2 maternity leaves during it, so it was a bit extended. I was involved in 2 big prospective clinical research studies. So first of all, I was involved in Radica, which was an asthma diagnostic study, and then the PAFA study, which was to measure the prevalence of adult food allergy in the UK. I also took the opportunity during my ACF to do other master's modules. I did some work with the Clinical Research Network team, looking at the barriers and the facilitators to GPs working in research. I built a cohort of GP ACFs up in Manchester, and me and a colleague produced monthly meetups and produced a training programme. This really made me realise how nice it is in research to be part of a cohort, which is what the SBCR programme also provides. I also joined the BSACI Primary Care group, which was an allergy group, and met people across the UK, which was really beneficial, understanding other people's research that was going on in the area. Jess, if you could move on to the next slide. So after the ACF, as mentioned, I'd worked on the PAFA study and realised there was a lot of work to be done in adult food allergy, and was really keen to continue academia. And I was very fortuitous in that my timing was perfect. And at the end of my ACF programme, the first year of the SBCR PhD for Primary Care Clinicians came out. During my ACF, I'd written a review article looking at the diagnosis of food allergy and realised that there was scope to do a lot more work in this area. And NICE had actually released a placeholder saying, most of our guidance is based on paediatric research and we need more research to be done in the adult population. So it was a great foundation to formulate questions in research. We'd got a lot of clinical data in the PAFA study, so I used this to formulate more research questions that I could answer during my PhD. Jess, next slide, please. So just to explain where I placed myself for my PhD, I was based up in Manchester, and during the PAFA study, I worked with Professor Simpson, who works in respiratory and allergy. She's a clinician, and Professor Mills, who's an allergologist working in lab. We also worked with the University of Southampton and Amsterdam. So I had those relationships nationally and internationally, which were really interesting. We worked with Anaphylaxis Campaign, so charity groups, and it was funded by the Food Standards Agency, which was a great experience in terms of policy making and how research can impact policy. As I previously mentioned, I'd reached out to the BSACI Primary Care group, and through that met Professor Ridd, who is a professor in primary care at the University of Bristol. And Professor Blakeman is one of the SBCR leads in Manchester. And he'd been brought on with to Matt's study as PI in Manchester, looking at skin prick testing in under 2s with eczema, and very kindly invited me to meet Matt. So that's how I met Matt as a supervisor. And again, very nicely, they said, would I like to be co-PI for Manchester on the study? And I've had a wealth of experience from them both as being part of that. And that study is still ongoing alongside my PhD. And it's been really interesting experiencing Manchester and Bristol. And it shows how the strength of collaborations, because they work very differently, both have strengths, and it's been really interesting experiencing that. Jess, if you move on, thank you. So I wanted to apply for the PhD. I had my supervisory group. I knew the subject that I wanted to do. So next, the application. The application's a bit smaller than the other larger MAHR in terms of how much you need to write. But I think there's a skill in getting everything that you want to across, but being very specific on what you're saying. And it went through numerous iterations. My supervisory group read it, professors read it, I got other PhD students to read it, But at the core of that, I knew the questions I wanted to answer. I felt really passionate about my subject and the impact I wanted to make by answering those questions. And I would say, when you're writing your application, really stay true to what you want, the work you want to do. It'll be you undertaking it. And it's a long journey. And if you can stay passionate to that, then that's going to really help you along the way. Do obviously take the advice of all these expertise, because it's really good, but do stay true to what the work you want to do. You will be asked about presentations and publications. Obviously, you need a bit of a track record in that on the application. And then also PPIE, you'll need to think about patient and public involvement. And again, it was actually Matt at Bristol reached out and said, actually, Hannah, we've got a really good PPIE group in primary care. And within 2 weeks of meeting the PPIE lead, I had a great focus group set up, got a wealth of knowledge from people with food allergy, without food allergy. And it was fantastic to see, one, how the University of Bristol was set up, also have that experience for my application. Just remember, you do need to cost it. You'll have to pay the participants, but that was really, really useful. Produce a training plan. So a lot of people are doing methods in their PhD that they might not have done before. And there's great courses out there across the UK. So I've done some in Bristol, in Oxford and Manchester so far. But make sure you think about what you need through your PhD programme and also cost them appropriately. So that leads on to costing. You need to cost your training plan, your research, your PPIE, yourself in HR. And Rita Chow at Manchester, who leads for SPCR, was absolutely fantastic. Did a very quick turnaround for me, which was really nice, and helped me cost it appropriately so I could put that into the application. Jess, could we move on? Thank you. So if after the application, hopefully successful to interview, and I'd just say, know your project really well. You've obviously spent a lot of time reading your application, and feed on the passion. You're doing the subject because you want to, and just let that come across. Know the background, know the knowledge that's out there, and make sure that comes across. Practice, practice, and practice. I practiced to lots of different people, professors, supervisory group, and again, PhD students, and my husband and everyone. And some of the feedback, what I really remember doing it to one professor who was quite brutal, but actually it shapes my presentation, and I will be forever grateful for her advice, however brutal. Know your methods. So I'm doing methods that I'd never done before, but I knew why I was choosing those methods, and I could answer them specific to my project. Just make sure you've done the background reading and understand the methods that you've chosen. Expect lay people on a panel. It's really important that you can talk about your research in lay terms. And also there's lots of PhD questions online. Think about how you'd answer them specific to your situation and PhD. And Jess, next slide. I think that's it from me. Thank you.
Thanks, Hannah. I think we're going to, if it's okay with you, I think we're going to take all the questions at the end, if that's okay. So if people have got questions for Hannah and they want to put them in the chat, then I'll read them out at the end.
Yeah, that's fine. No problem.
And now welcome, Tom. You're going to tell us about your experience. Thank you.
So hi everyone, I'll attempt to share my screen if that's the done thing, and hopefully this will work. Is that displaying okay? I've got a nod. Fantastic. Excellent. So hi, everyone. My name's Tom Kallis. By background, I'm a clinical pharmacist, and I'm also entering the second year of my PhD at the University of Exeter. And this, similar to Hannah's, this is a little bit of a background of my journey to being awarded a PhD for Primary Care Clinicians Fellowship, and how I arrived at my research programme focus, polypharmacy, pharmacists and clinical uncertainty. So a little bit about me and my background. So prior to being awarded the fellowship, I had very little exposure to clinical academia or to research, but a PhD is something that I've always wanted to do. For pharmacists, there isn't, certainly at the point of my application, there wasn't a really clear career pathway going from practice into getting involved with research or academia. I know things have changed now, and a lot of other healthcare professionals are in that process of trying to get more clinical academics involved in research. But coming into the role, I was a PCN, a primary care network clinical pharmacist in East Cornwall, and I clinical practice in mental health and complex pain and polypharmacy review. And I'd done a lot of other previous clinical roles, such as medicines optimization, community pharmacy, and a little bit of teaching, but certainly nothing formally in the world of research. I had the opportunity to undertake a postgraduate MSc in clinical pharmacy, which looked at decision making and when pharmacists prescribe and review Z drugs in primary care, but certainly at the point of applying for the PhD for Primary Care Clinicians Fellowship, I didn't have a publication that came out of that. That came much later. So I didn't have a massive track history in terms of research outputs or previous things that I've been involved in. And I was very privileged to start my PhD for Primary Care Clinicians scheme in October last year. So what did my journey look like? So really from the start of seriously applying for a PhD to finally being awarded a fellowship took me about 2 years. I found academia as a pharmacist a complete black box, particularly with regard to clinical academia, because as I mentioned, there's no clear career pathway, although that is changing. So I looked at various options. I looked at PhD studentships online. I looked at professional doctorates such as the DPharm, and thought about what ways I might go about trying to apply for a PhD. I got in touch with one of the academics on my undergrad course. So I was 10 years qualified at this point, and said, look, I'm really interested in doing a PhD. How do I go about it? And they pointed me in the direction of a MRC fellowship. And I thought, fantastic, it looks like a job application. I entered a darkened room, wrote the application myself, and then was promptly turned down from the MRC program. I thought, okay, I've got to do something a little bit different if I'm writing an application for a doctoral program. I next came across the GW4 Clinical Academic Training Programme, which is another Wellcome funded PhD programme, similar to the NIHR scheme, which looks to try and actively recruit practicing academics, practicing clinicians into a doctoral programme. And it had just opened up to include pharmacists as well. I spoke to 1 or 2 people when developing my application for this PhD program, but similarly, the majority of the writing was done in isolation. I sent the application in and was really over the moon to be offered an interview. I did lots of practice with clinical colleagues, but I didn't seek the advice of many academics. And in retrospect, when I went for that interview, there were lots of obvious questions that I should have prepared for that I didn't really have the solid answers to. So I wasn't successful in the GW4 CAP program, but the advice that I got back from the interview panel, when I went through that process was actually, it sounds like you're really interested in health services and primary care research. Have you considered any of the NIHR schemes? And that's when I stumbled upon the PhD for Primary Care Clinicians program. I thought I had to do something really different for this one. So I thought, instead of trying to keep this to myself and, not letting anyone know that I've been unsuccessful, I'm going to tell everyone under the sun who will give me 2 or 3 minutes of my time that I want to do a PhD, I'm interested in research, and how do I get involved with research as a clinician? It was through talking with a lot of my local network that I, by chance, was connected with Rupert Payne, who would then go on to become my principal supervisor, because he was a new professor at the University of Exeter interested in polypharmacy and medicine optimization, which were overlapped with my areas of interest as well. From that chance meeting, we began to build up some research questions together and look for funding and think about how I would build my application for the PhD for Primary Care Clinicians scheme. So the option was either to apply from a list of projects on the PhD for Primary Care Clinicians scheme list, or to propose your own. It was a really interesting experience to develop my own PhD program, make my own research questions, and think about what methods I would use to deliver the research as part of my PhD, as part of the application process. And it was a really intense program over probably about 3 months to pull everything together, from the point of thinking about applying to actually submitting, and then going on to interview. All I would say was I spoke to everyone in the department. So Rupert very kindly introduced me to other academics. I went to the campus, met other senior clinicians, met other senior clinical academics, spoke to the departmental leads, and anyone who would offer me advice, including other PhD students, or give me a few minutes of their time. I grabbed it at every opportunity, and that really fed into how I built my application. So a brief overview of what my PhD now looks like. So my big question was, how can clinical pharmacist decision making be improved when delivering patient-centered medication reviews in the context of complex polypharmacy and clinical uncertainty? And what do I plan to do? So phase 0, not on here, is the underpinning literature review, getting NHS ethics and developing research protocols, building a PPI team, which is what my last year has been spent doing. Now I'm on the cusp of actually doing the research, which is audio recordings of pharmacists delivered structured medication reviews in practice, interviews with pharmacists to understand the decision-making process, and interviews with patients to understand what patient perceptions of pharmacist delivered care when doing structured medication reviews look like. I'll then plan to take all of those data and feed them into a final round of focus groups and potentially a consensus exercise to come up with some recommendations about what a future intervention might look like to mitigate clinical uncertainty when pharmacists review polypharmacy, or to develop some educational recommendations. So, what would my advice be around some key considerations for me that I would have valued at the start of my journey applying for a PhD program? Really think about what your research interest is and think about how you develop them into questions. So if you've got contacts in academia, if you've got a supervisor you want to work with, they will be able to help you work those up into really robust questions. And there are webinars out there that have been recorded previously through NIHR incubators about how to develop really good research questions. There's lots out there that you can look into. And then think about, if you don't have someone, an academic or a professor or a supervisor you want to work with, start looking at the SBCR institutions and see what academics are working within those schools who have research interests that overlap with yours, and start to build your network. Reach out to them and say, this is my background, I'm interested in applying for this PhD fellowship, or I'm interested in doing a PhD in this area, and start having those conversations. I found that power imbalance really daunting. I thought, my goodness, I'm a lowly primary care pharmacist. I could never drop a professor an email and just say, hello, I'd like to come and work with you. But actually, it's really important, and you're offering to deliver a program of research in collaboration with that academic as well. So certainly try and see past that power imbalance if you've got any of those reservations, because linking out to people and building your own network is really important and will support you along your journey of building your application. Think about where you want to be based, and as Hannah mentioned as well, think about how you might get the patients and public involved with your application. So PPI, as it's badged, was completely new for me. So I thought, my goodness, how am I going to get the public involved with my application? I went to the practice patient participation group in the GP practice I was based in and shared my application with them. I had a meeting with them and said, here's my plain English summary. Does this make sense? What would you change? And we built that together. And although those people aren't part of my current advisory group, they very much contributed to my application and helped me shape it in a co-produced way. Also, as mentioned previously, you're not expected to know everything at this point. So you may have an idea of your methods and why you want to do it, but these PhD funding opportunities are to develop you as future researchers. So think about your training program that you want to access. What courses are out there? It might be an MSc module, it might be a short course delivered by one of the primary care schools, and include them in your application. And you can nod to them and say, actually, I don't have these skills now, but I've got a really clear plan of how I'm going to acquire these skills to enable me to deliver the research that I'm proposing to do as part of this fellowship. As mentioned previously, network, talk to people in the institution you're interested in, and their finance department will be able to support you with building up things like costings for your PhD. So there'll be standard rates that you'll be able to access. There may be a contact who will be able to give you an insight into what rates you should cost things in your application. It doesn't all need to be you. Very much these applications, I feel, are built by a combination of multiple people collaborating together around you leading the process. I know certainly my application for the PhD for Primary Care Clinicians programme went through at least 12 iterations, being shared out externally with my supervisor, and then my the other supervisors who joined later on as the application developed, and other members around the department who are happy to lend their advice and lend their insights. And I would just say, if you're not successful, just bear in mind these are really competitive awards. A lot of PhD studentships and fellowships are. Don't feel that the story ends here at your first application if you're not successful. Think about the network and the relationships you've already built. build on them, think about how you go for the next application. It's not a failure if you've not succeeded the first time you put one of these in. They're incredibly competitive. It's all part of the process of getting that experience. It makes your next application stronger, and don't be disheartened. Take the learning from it. Think about all of the people you've already linked in with and keep going, because you will get there eventually. So that's a whistle stop tour from me. I'll stop sharing and hand back over.
You can see the website here, and all the details are on the website, and we are recording this webinar so that you can also look back at it if you want to. So thank you, Jess. If you go on to the next one. So the reason for doing this is to increase the pipeline of people who are able to do high quality research in primary care. And so the Wellcome organisation gave us this funding for primary care clinicians to develop as academics of the future and to become leaders in primary care research. So hold on to that when you're thinking about applying, because we need people who can show that they're in primary care, they plan to stay in primary care, and they want to do projects that are relevant to primary care, and that's super important for our criteria for these. And it's tricky because it's tricky to define primary care sometimes. So if you're not sure whether you're actually in primary care and fulfill the criteria, have a very close look at the criteria on the website. And if you're not sure, email the contact email to check before you put lots of work and effort into applying. So all primary care clinicians are eligible. You've got to be working in primary care, and you've got to be employed by the NHS and not in a private organisation that's contracted out. Locums are eligible to apply so long as they have a long-term plan to carry on working in the NHS. As far as I'm aware. Steph, if I say something that's inaccurate, do make sure you correct me as I go through. So I think that was all I was meant to say about the rationale. So if we talk about the practicalities of funding, so you have to have a contract with the host organisation, the university that's hosting the PhD, and also have a honorary contract with your clinical organisation, and that's usually with your current employer if you're maintaining clinical work. And that is not always straightforward, so plan early, talk to everybody early about the logistics of this, because those things take time to work out the right person to talk to make that all happen. This funds a clinical salary, which is very fortunate, because a lot of people doing PhDs go down to a stipend PhD funding, which is much lower than is available. So it's very fortunate funding stream is to fund clinical salaries. And there is a cap on the clinical salaries that is clearly set on our website. So just check, because some clinicians that are very experienced may be above our cap, and we can't go above the cap that's on the website. The PhD does include some funding for research costs as well as the fees and the clinical salary. And there is, you need to specify in your application to some extent what you want to use those research fees for, as well as a training programme. When you're thinking about who you're having in your supervisory team, as you saw from both Hannah and Tom, you can have a range of people in the supervisory team, and they can be at different institutions. We very much encourage people to have at least one other institution from within the group that's offering these PhDs as in your supervisory team to give you broad experience. And you're going to want a range of people who are experts in your topic area and your methodology to give you that support you need as a supervisory team. And a lot of universities allow up to 4 people in their supervisory team. I think that's everything on funding. Is there anything I should be adding, Steph?
No, I think just to mention that we do have research funds, but there is a cap on them, normally around 25k. So it's not possible to do a clinical trial, for instance, within this, because obviously that's very expensive and you need to involve a trials unit. So think about the research, but I mean, there's funding for PhD amount of research, but there's not funding for an expensive clinical trial.
Yeah, and a PhD is a training award, so it is the training package is really important as well as the research. So if we go on to clinical work alongside the PhD, so Wellcome are very clear about this, and we've had lots of discussions with them, and there's guidance on our website about this. But the focus of this is gaining a PhD, and they will allow you to undertake clinical work, but it needs to be supernumerary. So you're allowed to undertake up to 1 day a week equivalent of clinical work, which must be supernumerary. So you need to make your organisations very aware of this when you're talking to them about applying for this. There's some flexibility for the GP applicants, Steph, isn't there?
Yes.
In that they can front load their clinical work if they like, so they can take a little bit more, undertake a little bit more clinical work in the first year of their PhD, but then overall it needs to average out to the 1 day a week. Unfortunately, Wellcome wasn't able to provide that flexibility for other clinicians. That's as far as I'm aware at the moment. Is that correct, Steph?
Yes, that's not changed as far as I'm aware. We had to plead to get them to do that. So can I just go over that again? Because I think people find this particularly confusing. Wellcome are very generous. As you've heard, these are salary funded PhDs, more or less. There are some caps. So they're very generous PhDs. This isn't like a stipendiary PhD. But they're very keen that that whilst you're doing this, your job is being a PhD student, so that they don't want you to feel that you have to work clinically and get very stressed and it compromises a high quality PhD. So the flip side of their generosity is that they don't allow people, you can do the PhD part-time up to 60% full-time equivalent, but what you can't do is use the spare time to go off and do another job. So you're funded full-time to do a PhD, and within that full-time, Wellcome will allow you to work up to 1 day a week clinically if you want to do that. If you're part-time, they'll pro-rata that. So you could be part-time at 60% and work at a pro-rata amount clinically. But if you do the clinical work, your PhD fund and your full-time PhD funding is still 3 years. They don't extend it beyond that. I know it's a bit confusing to get your head around at first. But just regard it as a job where you can keep your clinical registration up, your clinical experience and expertise going, but you're then supernumerary, which is a great position to be because you're then like a gift to the practice that you're working in. And that means you can negotiate the job you want. So maybe when I was doing 1 day a week in general practice about 6 years ago, I used to get in on my 1 day a week in general practice. I would get in before 8 o'clock in the morning and I would be the last person to leave. I always left about 10:30, 11 o'clock at night. You wouldn't be doing that if you're doing a PhD. So you're protected from that because you can negotiate with your practice. So, well, you know, I'm a supernumerary, so I'm a free gift to you. So could I have a slightly shorter clinical in the afternoon or whatever?
So do you want me to keep going, Steph? Or are you going to?
I could carry on. Sorry, I'll carry on if you like. So how to apply? Well, I can't emphasise enough that we've tried very hard to make it as clear as possible. So the first point of call is always to look at the website, and we've got all sorts of stuff on there about how to apply and to support applications. It is an online application this year. Those of you who know people who've been in it before, it wasn't the same before, but now the school has invested in a nice, slick online one. It is possible to get a PDF, a blank application form, isn't it, Jess? Just remind me. I know I always have to do that when I've got an online. I like to know what the whole thing's going to look like in terms of the structure of the application.
Yes, you can do that, but we also do have the question list on the website as well. So
perfect.
you'll be able to check
Thank you.
it there.
Thank you. So it used to be some NIHR applications that was quite hard to do. So so you can see what the questions are, but it is an online application this year. Applications have to be in, I think it's midday on December the 12th. So please don't leave it to the last minute in case there's any electronic glitches or problems with your computer. I always say, I like the online applications to try and get it in at least a couple of days in advance if you can. I don't think there's anything else to say about that. Applications.
I guess, Steph, just to reiterate that although we supply a range of potential projects on the website, you don't have to do one of those projects. They're just there to give you an idea of the type of projects that would be offered and acceptable, and the type of supervisory teams you would have. You are allowed to bring your own project, but you must contact the people that you want to host your PhD and have talked to the supervisory team, make sure they're on board before, so that that it's been worked up and is feasible and doable. But we try and make sure there's a range of projects up on the website to give you some ideas, to give you some points of contact into people in departments, and to give you an idea. But it's not at all compulsory that you have one of those. You can develop your own project.
Thank you for reminding me of that important point, Hazel. And also to reassure you, it is neither an advantage nor a disadvantage to do the pre sort of selected project or to do your own project. Everybody's treated equally on merit. But what I would say is that you do need to speak to your supervisor, at least your first supervisor, and have a good chat and before you submit. And we do check that people have been in contact with supervisors. So every year, unfortunately, we get a few people who have, I don't know, they've just not contacted anybody, and it sort of almost automatically disqualifies them, because you have to have had it. It's a PhD. We're making a huge investment in you, and it's, you know, we want people who are serious about doing a PhD. So obviously, you want to speak to your supervisor.
And if you're going to do one of the projects that's been put up on the website, it's not acceptable just to copy and paste that summary onto your application form. You need to have thought about it, and you need to put some stuff in your own words showing that you understand what it is into the application form, so we know you haven't just copied and pasted it across. Okay.
Yeah, that's really, really important as well. And also that's why speaking with a supervisor, because you may change it, you may evolve it from that. What's up on, and we'd expect that. I think we've been asked to remind you about public involvement. Even in this application, do try and get some public involvement if you possibly can. If you can, speak to people who are experts by experience or carers, and just to sound out your ideas. They'll tell you if they think what you're doing is trivial or really important, and give you some pointers as to the things that are important to them, the outcomes they're interested in, what matters to them. And that voice of the patient and the public should even be coming throughout your PhD, but it certainly should even be there in your application form. Again, speaking with your supervisors will help, and there's tips on our website about how to go about doing that as well if you're brand new, and links to a community engagement toolkit.
And there is also 2 upcoming webinars on public involvement coming up through the School of Primary Care Research, and Jess has handily given me the dates of Wednesday the 2nd and Wednesday the 16th of October, and you can link to register to those on the school website so that you get experience and understand what we mean by PPI involvement.
Please do that if you're new to PPI. I think that'd be very, very useful for you to do. Should I move on to talk a little bit about the interview? And Hazel, do chip in. So we take applications very seriously, or every application that's sent to us by midday on the 12th of December will be reviewed by 3 academics from different institutions and from different backgrounds. They won't all be doctors. Allied health professionals are well represented in our reviewers. and they're working independently. We will review and score all the applications, well, the selection of the applications, but every application is done by 3 people. And separately, our expert PPI group will look at them. And Hallie, we have a PPI lead for the School for Primary Care, and Hallie coordinates all that. And also, as well as the PPI looking at the applications, they also have a debrief with Hallie, so we get their individual comments and then their overall comments. So that's very, very helpful. And based on that, Hazel and I do shortlisting, and if there's any discrepancies, for instance, somebody appears to have had a particularly hawkish reviewer, we look into the application. So we try and make it as fair and as transparent as possible, and then we shortlist the people. Sorry, we identify the people who we're going to invite to interview, and interviews are going to be held in the week commencing the 17th of March in person in London. And I actually think they're going to be on the 19th and 20th of March, but just put a question mark next to that. But certainly do not plan a holiday if you're going to apply for this and the week commencing the 17th of March. Make sure you're around. Interviews are held in person, and they'll be in London this time. Last time we did them in Birmingham. So we tried to make them a place where it's easy for people from different parts of the UK, relatively easy to get to. And obviously we pay reasonable travel expenses to get for you to go if you're invited to the interview. The interview panel is quite big. There's 5 to 7 people on the panel, including 2 public representatives. And they always begin with asking for a presentation. We try and change the presentation. It will be about your project, but we might change the title and the brief slightly each time to keep it fresh. And then there'll be questions. So one of our, I think it was both Tom and Hannah talked about the importance of interview practice. And I think everybody who sits on the interview panel, for starters, we're all blown away because the caliber of the people who get to interview is very high. And we often sit there thinking, goodness me, they're all so fantastic. We want all of them to have a PhD now, which of course is impossible and put, you know, so, but though I hope they will go on to succeed if they don't succeed with us in other PhD programs. But the thing is that people need to practice because you can be sure that the other people on the interview who are being interviewed will have practiced. So please get your supervisors to give you practice interviews, and get colleagues and friends too, and other PhD students, etc. So try and have 3 or 4 interviews, mock interviews if you can, and just to get you really on your mettle for the actual interview. Is there anything else you'd like to say about the process, Hazel, that we've not touched on?
No, I think that's all. But to say that the interviews are friendly, they're obviously challenging to make sure that every candidate can show their best ability. But it's a friendly panel. When we're not trying to trip people up, we're trying to get everybody to do their best so we can pick the best candidates. But it is in person with a presentation, so it's really worth getting some practice. Steph and I can't reiterate that enough.
Yeah. No, we are friendly, and it's not like one of the interviews that I've been to where there's like 100 people in the room and it's a bit daunting. It's a smaller panel, and we do smile, and hopefully it's as pleasant as an interview can be. And the reason we do it face to face and in person is because that's what candidates have told us, and we feel they're right, and you get the best out of someone if they can see your body language, you can see their body language. We're all on the same page if we're in the same room together. So that's why we're doing them face to face. I think now, unless there's anything else anybody, Hazel or Jess, want to say, or Hannah or Tom, I think we should open to questions.
We've got a lot of questions already, so I'm going to start working through them. And some of these, if they're eligibility questions, it might be that we can't answer them right now on this call. It could be that you need to email in a bit more information, and then we'll get back to you. But the first person has asked if they count as a primary care clinician as a community midwife, and that might be relevant for a few people. So if you wouldn't mind giving your thoughts on that, Steph or Hazel.
Hazel, what do you think?
I think it's what we need is people who are linked into primary care and seeing primary care clinicians who are primary care clinicians who are seeing primary care patients. You have to be registered with a registered body. So obviously as a midwife you would be, so you'd fill that criteria. You have to be doing a primary care project, so it would need to be a primary care project as well. But I don't think there's a barrier to midwives if they're actually working in primary care rather than secondary care, is my understanding, Steph.
Yeah, but partly also I think you can be guided by who your employer is. If you're employed by an acute trust, then you're not really, unfortunately, you wouldn't be eligible, even if you're doing some work in the community. But if you're employed in the community, I mean, when I trained, this shows how ancient I am. We actually had our own midwives in the practice, and obviously they were part of the team. They were primary care team members. They were doing antenatal and postnatal clinics in the primary care setting, and they were attending home deliveries and then escorting people, and then sometimes, you know, at the outreach unit at the hospital. So it slightly depends on the person. You'll know in your heart, I think, to be absolutely honest with you, you know if you're a primary care person or so. Sounds a bit vague, and if that's not clear enough, we can always enter separately into a conversation about that via email or even speaking. So do contact us if that's not clear enough. Thank you.
Okay. Thanks. I did notice a couple of people have put their hands up, but if you could actually pop your question in the chat, that would be really useful. Thank you. The next person says thank you to the speakers, which I'd like to echo because I think those were great presentations and makes it really useful for people. But this person says, sounds like you need to have a research background to apply. Is this right? Maybe Hannah and Tom want to take this one first.
So I can give an insight. I certainly didn't have a long track history of research in terms of my route. I really wanted to get involved with clinical research and would look for opportunities to do things. So I think the extent of what I had done up to that point was I'd had a few informal things published as editorials, and I'd collaborated around a research poster, but I didn't have any publications, any formal primary research publications at the point of applying for the PhD for Primary Care Clinicians Programme. I did by the time I'd started the programme, but I think that I just reflected on that on my application was that I looked for any opportunity to get involved in research, and I reflected that by doing the clinical pharmacy MSc, but certainly my role didn't have any formal research component to it. But I think that's reflective of the role of pharmacists at that point. There's no formal route into clinical academia. It is changing now, but I would suggest that it's the case you make in looking for opportunities. And if you build your network and your collaborations, although even if you don't apply this time, you're looking to apply the next year, there's stuff you can do in the meantime there, and you can get involved with stuff. Or if there's CRN stuff, you can be an investigator in practice or support some kind of research project. All of that will support as well. But I certainly was a relative novice in the realms of research when I was applying.
I think what we look for will be an interest. And you see, when Tom wrote his application, he may not have had publications, but there's somewhere in there you can track through that he's interested in research. And, you know, and sometimes that might be, you know, you've done a quality improvement project or an audit or something like that. But you can, and often, or maybe some people have done a little bit of research in their undergraduate, or they, you know, if they're medical, they did an intercalated BSc and they did some research. So we're looking for an interest in research, not obviously if you were very experienced researchers, well, this wouldn't be for you because a PhD is a research training. First and foremost, it's a research training, but it also delivers good research. So it's, I always say, I was bored of hearing me say this, but I think a PhD is a sort of double good because you develop somebody and give them fantastic training, and you also get some really decent research out of them. So it's a sort of, you get two good outcomes for one package. So, but you know, you're not even expected to be PhD standard when you start the PhD. Obviously, you should be PhD standard when you go to your Viva at the end, but it's all a journey towards there.
Thanks, everybody. The next question is about whether you have to have a contract with the university and the honorary clinical contract in place to be able to apply, and the answer is absolutely not. So the only reason I think we put that in is that it's worth having those conversations. Tell your employer that you are applying for this PhD, and if you were awarded it, that you would therefore need an honorary contract to continue your clinical work if that's what you were going to do. And in terms of the contract with the university, that would only be in place for award holders. And through the kind of process of you talking to your supervisory team, then hopefully the department would be aware that you were maybe going to join the department. And so that's also a conversation that they could facilitate. So that's that one. The next person says, can I apply if I work in a GP practice? Most GP practices are private businesses delivering NHS services, but I think absolutely. Hannah, I don't know whether you want to give your experience of that.
Yeah, definitely. I think a lot of the GPs on the programme are salaried, so we basically converted into a university contract. And as Steph and Hazel said, you then can, because you're clinically funded, I can't stress how, as a GP, how lovely this scenario is to say to your practice, I'm going to be free to you, and can I work for you for free? And therefore you are protected. Steph is right. You can make your own, offer your own clinics, whatever you want to offer in that day that you get funded. You're free to them. You're an asset and they love you. So it's a really lovely place to be in. So take the opportunity and enjoy it. I think there has been queries around partnership before, but I'm afraid I couldn't answer that because I just got, someone reached out to me to ask if I knew, and I don't think any of my colleagues, GPs that I know, were on a partnership. So I'm not sure. I think Steph and Hazel would have to offer that, and it would obviously, you would need to speak to your partners of how you would facilitate that going forward. You obviously need discussions with them, in that you obviously run a business, but salaried it's very easy.
Thank you.
Like staff nurse count as a primary care clinician, and again, maybe hopefully it partly was answered by the last question. And if you've got a very specific query about your specific situation, who you currently work with, who you currently work for, please do get in touch so that we can answer that. The next question is this session recorded? It is. It will be on our YouTube channel by next week if you've missed anything. And then the next question is, if you're doing the PhD part-time, can it be undertaken over longer than 3 years?
Yes, that's what it's prorated. And also the supernumerary clinical bit is prorated as well. So you'd have the same amount of time but spread. You can do it at 60% or 80% full-time equivalent, but not below 60% full-time equivalent. I just don't think you cope with that going forever. But yes, very much so.
Somebody's asked if international students would be eligible to apply, and would they require a GMC registration? And I guess if that would translate to a UK-based registration for any clinical background.
I think really should be home students because it's for people working currently in the NHS. So I suppose if there was somebody who, it's kind of hard to imagine that they wouldn't be eligible for home student fees. And we only cover home student fees. So you have to be eligible for home student fees and you should be working in the UK NHS. So that would preclude most international students.
And you must be registered with your a regulatory body.
Yes, exactly. So you must have a professional. Sorry, you must have a professional regulatory body. So, for instance, if you're a primary care psychologist, psycho BAC, I can't say it, BACCP or whatever it's called, they're a regulatory body for psychologists, etc.
Thank you. Next question for Hannah and Tom. Roughly how long did it take you to write your application and research proposal?
Do you want me to go first? So I was coming towards the end of my academic clinical fellowship, so I was already thinking, I knew I wanted to keep going in research. I had my research questions, so I was working during my academic clinical fellowship, to be honest, thinking about the next step anyway. And I would say for your PhD programme, when you're thinking about that, think about why you want to do it, what it's leading towards during your application. They'll want to see what future you see in academia, so it's always useful. So I had been proposing questions. But I was in the first year, so I think it got, I mean, trying to rack my brains, but I think it got announced in the December and the application was in the February. So I was an unusual year in that it was quite short-lived by the time. So it was quite an intense 2 months, I'm going to be honest. I worked extremely hard in that 2 months to try and hone it down. But what's lovely in primary care, and I'm not trying to say other areas aren't, but everyone's so approachable, so lovely. Like I say, all the professors in Bristol, in Manchester, the finance Rita, the PPIE group in Bristol, they all desperately wanted to help. The turnaround that they did to help me get my costings and everything. So people are there to support you. The professors and other PhD students were aware and really helped me turn it around. But it is something that you need to put a lot of time into, because there's a lot of iterations to go through, I would say. So I'd start thinking about it as soon as you can, really.
I completely agree with Hannah there. The longer you can give to it, the better. I think mine was 3 months over. We worked it up, and that was a really intense 3 months alongside full-time work. There were lots of very late evenings, and without my husband running the house, I think everything the wheels would have fallen off everything else. So it's a lot of time, and think about your external partners you're going to involve with it as well. So although you'll be working at breakneck speed to put it together, if you're on a short time scale, you'll want to involve the public, your supervisors, talk to people, get feedback on it. It's factoring all of that in as well. So the more time you can give to it, the better.
Thank you. I'm really aware of time. We've only got 4 minutes. There's quite a few unanswered questions. So what we'll try and do is we will kind of download all of those, respond to them, and maybe send out some responses to everybody who's attended this webinar. But I will just do one final question, which is, would there be any support for students with dyslexia? And I don't really know whether anybody can answer that directly, but I do know that every host institution should have great pastoral care, and there should be resources available to every single student across the country for additional support with things like dyslexia. And if you're applying and you state that, there's a place on the application form where you can give us any additional information that you might want to let us know about, and you can put that there if you feel like it's going to have affected your application.
Yeah, I mean, really saying that we do really pay attention to that contextual box. So if you have got certain circumstances that affect your application or your ability to do an interview or things like that, then you put them there and we'll make any adjustments we could. The same with universities. If you talk to your proposed supervisor, they will tell you about what's available in your university for making sure that you get adequate support. Universities are very set up for people who have additional needs.
So I don't think we've got enough time for any more questions, but thank you so much to Hannah and Tom for your presentations. And thank you for everyone who's come. And as I said, if you've got additional questions, you can always contact us at spcr@keele.ac.uk.
Thank you all.